Hello, and welcome to Reed Scholars Live. I'm your host, Dr. Mary Fleming, current president of Reed Scholars, and I'm super excited today to have with us Michelle Johnson. Michelle is a lot of things. She wears a lot of hats, and so we're super excited to dive into a few of those today. We met through our maternal health experience over the past couple of years, and so we'll talk a little bit about that, talk a little bit about reproductive justice, talk a little bit about Michelle's journey through motherhood and what prompted her to write not one, but two books. So she's also an author, which is amazing. So with that, let me stop it and just ask, how are you doing today?
I'm doing well. I'm doing well. No complaints today. How are you?
No, I'm doing well. No complaints is a good thing because Lord knows we can complain a lot about a lot of things these
Plenty.
days.
Yes.
So let's dive right in and talk a little bit. Let's start with our common ground in maternal health. So, talk to us a little bit about how you got interested in the space and kind of your journey through that space as an advocate and as a maternal health professional.
So I feel like most people, when they answer this question, they always say, I've always known that I wanted to do this or that. But for me, it is true. I wanted to have a runaway homeless youth shelter for parenting and pregnant teens since I was maybe 14 years old. And I always said it, and people would look at me like, why is that something you want to do? Like that's not going to make any money. That's always the thing people say when you're in high school and you're thinking about college. So I kind of tucked it in my back pocket. And then I had a friend who was pregnant the maybe third year. So yes, our junior year of high school. And my mom, she was very supportive of this friend. She'd be like, "Oh yeah, bring her home, or we can bring her to church with us. You know, what does she need?" And I stayed really close to her, and I don't know why. We actually became friends through her pregnancy. So I found out that she was pregnant in the nurse's office one day, and I kind of was like, "Oh, well, you're coming with me. I'm gonna help you. I'm gonna help take care of you and a baby." She actually called me when she was going in labor, and my mom dropped me off at the hospital. So I was there after, well, I didn't go in the room during, but after gave birth, I was in the room, and that was my first introduction to what preeclampsia was. She suffered from preeclampsia during her pregnancy, and she was in the hospital for a few days. She recovered and came home. Her and baby were healthy. So throughout that time, just watching her recover and postpartum, I was just like always asking questions. It was so interesting to me. And she was a 16-year-old with a new baby, and she was kind of annoyed by that. So later on, we both became pregnant at the same time, her with her second and me with my first. And I realized that our pregnancy experiences were so different, even though we were no longer 16 years old. We were 25 having children. And I realized that there were some tests that I had done or some level of care that I experienced in my pregnancy that was not like hers at all. And she would be asking me questions and like, can you ask your doctor this? Because my doctor isn't being really thorough. And that is when I decided, after I have my daughter, I think I know exactly what I'm going to do for the rest of my life. Um, and I had already gone to school for sociology. So I did a lot of work. Morgan State University, where I graduated from, has a rich history in activism. So I had that background. And I think I spent a lot of years after graduation just trying to figure out where to apply it. So after I had my daughter, I decided to go and train for my doula certification. And it all started to make sense after that. Um, I, I was just like, I don't know how I'm going to fix these disparities that have been going on during COVID or were highlighted during COVID, but I knew that I had to do something. And the rest is history.
Okay, so let's unpack like so much that you just dropped right there. So one, for me too, thinking about high school and the young women at the time who were absent during our high school trajectory, if you will, because at the time I was in school, if you got pregnant, you had to go to a different school, right? And so just realize that they were absent and they would come back and they were absent and they would come back really had me thinking about how does that impact your education? How does that impact your workforce development, your, income development, all these things, right? All these things, these social terms of health that we can talk about later, right? But that really, to me, also started in high school, right? And understanding there was a difference And one of the things that I started thinking about through my training was access to contraception. And we can talk about that a little bit later when we talk about reproductive justice. So, very, very similar in how we started thinking about that at the same time. Also, you talked about being a doula, but you were really a doula before you knew you were a doula, right? And
Yeah.
doing support
Yeah.
through pregnancy and delivery and postpartum. And so I want you to spend a little bit more time. And on this show, we talked about, we've had doulas on the show too, but I want to talk a little bit more about what that means and how that impacts pregnancy outcomes. Um, and then thinking about, health disparities in general. So you mentioned preeclampsia. So for those listening who don't know what preeclampsia is, it's a disorder of high blood pressure during pregnancy. And for some pregnant people, it just means you have high blood pressure in pregnancy. We do some extra testing. We watch you a little bit closer, and your pregnancy ends up fine. For some pregnant people, it means you're on medication. For
Mhm.
some pregnant people, it means you deliver early, even preterm. It means you're on medication after delivery. So a whole host. It can range from a lot of um, along the spectrum. And for some pregnant people, it also means you could have a seizure. It can mean death. I mean, it can be really catastrophic. So having that experience as a young person, knowing what preeclampsia was at that age, imagine being 16 with preeclampsia and thinking about all the things that could happen. And
Mhm.
you're bringing a baby into that, right? So that
Right.
was a lot of exposure for you really early. And I can see how that definitely shaped your trajectory into maternal health. But let me pause right there and talk to us a little bit about what a doula is, how doulas have the ability to affect change in the maternal health pathway, and why like I said, you were a doula before you knew you were a doula, but what really pushed you to have the formalized training?
Okay. So a doula provides non-medical support during the birth and postpartum. And doulas wear different hats. So you have people who are end-of-life doulas. They support when there's a pregnancy loss. You have doulas who are strictly postpartum. And then you also have, I mentioned that already, end-of-life doulas. So there are many other um, spaces that doulas hold, but that's just like to name a few of them. I wanted to train to support Black moms. So I went through the National Black Doula Association. I did my training through them. And the reason why I wanted to is because I seen that we dealt with the most disparities. I figured out what maternal mortality was in 2019 when I was pregnant with my daughter and I was like in panic mode and I was Googling everything. Google, unfortunately, was my best friend. And I, like so many people, even now in 2024, who are like looking at these numbers, my jaw was on the floor because I was like, wait, so this is happening. People are like not coming home with their babies. And the numbers told me everything that I needed to know. This is the population that I want to work with. Um, and it was very clear to me that we are who needs us the most. And so my idea or the support that I am there to offer is to make sure, number one, that you have the support and your support is aware of the birth that you want to have, not only the birth that you want to have, when you go home, what kind of support are they going to offer? Um, are they knowledgeable of the way that you want to feed your baby? Are they knowledgeable of that first 60 days that you are going to be home with the baby and what that will look like and what they may need to look out for as far as your health? Are they making sure that you're scheduling your appointments and making sure that you're actually showing up and being honest about the way you're eating at home or some of the things that you may feel while you're under their care? And then talking to them about the development of their baby, the changes in their body throughout their pregnancy, and what is normal or what is not normal, those help signs, when you're pregnant. So that is what a doula does, provide education. I'm there to provide education. I'm there to provide support. And I'm also there to let you know that you don't have to take anybody's mess. That and
Yeah.
I think that's the part of birth work or doula work that always gets a little sticky because people they operate out of their scope and there's a way to do certain things. And I believe education is power. And so if I give you the education, I am not there on the day of your birth, or I'm not there in front of your family being a dictator. I've already given you the education, given you the knowledge to advocate for yourself. And you asked me something else and I forgot. Tangent.
No, I mean, well, let's double down on a couple of things there. One, yes, I think advocacy and empowerment are huge during the maternal health journey, and because it's like you said, there's a lot going on, and for people who have not been pregnant or have not um, accompanied someone through the pregnancy journey, you don't know exactly how many things can happen and how many things happen and change along the course.
Mm,
And every pregnancy is different too, right? So one pregnancy you might have, if it's your first baby, it's going to be different from your second baby. It's going to be different if you're with one partner or another partner. It's going to be different if you're at this job or living at this place, right? And so all
absolutely.
of those things people sometimes gloss over and how they can impact the pregnancy journey. So I think that's one. And so I think it is helpful, just like you said, to have the support to say, this is okay, this is not okay. You need to ask these questions. This is normal. Don't freak out, right? Like all of those things are helpful. I think you also hit on maternal mortality, which is, a big issue that we continue to talk about, especially in this country. You think about Black and brown women are 2 to 3 times likely to die during the pregnancy and postpartum journey as their white counterparts. And that number is not getting any better, even as we continue to talk about it, amplify it. We continue to see cases in the mainstream and social media too often about things that are just happening across the country, whether it's from, delayed care, lack of care, maternal health desert. I mean, we can go across the board. There's so many things happening that we need to address. And so one of the things that especially as we think about places that are lacking support, how doulas can fill in some of those gaps. We know it's not the magic wand. We're not going to fix everything with it, but it is something that we can layer on that's helpful, one, during the journey. And as you said, if you're in the room with your provider, your OB, your midwife, what questions can you ask? How can you advocate for yourself? How do you know if this is okay and this is not? And those are the things that we want to empower people to do.
Right.
So those were all good things. I think the only thing, I mean, I think you answered it, and I think what I was just asking, like, why did you wanted to make it formalized as opposed to just these are things you know how to do just as an individual, but you took it to the next step to get um, certified, and especially with that particular, because there's a few different certifying bodies of doulas, right? And so you can tell us a little bit why you picked that particular one as opposed to one of the other ones.
I picked National Black Doula Association because I wanted to know the history of birth work. I wanted to go a lot deeper into what birth work meant to Black and brown people. Um, that's really it. I knew I wanted to start there. I needed to know the history before I took a deeper dive. I didn't, I realized later on I never had to go through the training. Depending on who you serve and where you serve, you don't have to actually have like, formal training. But I don't believe in doing things that way. And it's like, no, I like to be a student. I'm actually, that has been a good thing and a bad thing for me. I believe in being a student for life. So I'm always in a training or webinar, just trying to fine tune skills. And I always want to be updated on like what's new and how I can best support people. And so that's how I ended up at National Black Doula Association. There were, I think, scholarships as well that were available at the time. So I seen it and I was like, that's it. That's perfect. I'm gonna do it.
I love it. I love it. And we touched a little bit on the social drivers of health, the social determinants of health earlier, and the role of doulas as support. Talk a little bit. I mean, I don't know if you have a story of somebody you served, but we talk a lot about what happens in the healthcare space. So what happens at the doctor midwife's office, at the hospital. But so much of what impacts our health is all the other things, right? Is transportation, access to food, access to housing, job instability, that type of thing. What can you tell us a little bit about supporting people across the rest of their life continuum that helps impact their maternal health journey and their pregnancy outcomes?
So I didn't know going into being a birth worker and doing doula work that it is not just babies and pregnant women and the postpartum. You are making sure that they have food, that they have adequate nutrition, that they have clothes on their backs, that they have a way to get to and from their appointments, um, that their housing is secured. And really, I became a certified community health worker in, I think, 2021. And I was like, I feel like I've been doing this my whole life. I just needed a certification for this. And it is so key and important in caring for um, pregnant women because if they don't have access to care, then how can we secure and make sure that they're having a healthy pregnancy? If they don't have food, then we get into the reasons why they we're dealing with, you know, fetal growth restriction and they're not having a proper diet and we're questioning, diabetes, you know, all types of different nutritional issues that come with, bad nutrition. And so I think that when people go into birth work, they should expect to be a community health worker. They should expect to become resourceful. Because you need to have resources to provide to depending on the population that you serve. I know
Right.
you know a lot of people who get into birth work and they're like, I don't want to deal with a certain population because it's just overall a headache and I just want to do what I do. And while that's not my thing, I respect it because you wanna cut out all the extra. I'm in it for the extra. Um, and I don't believe that I can do my job without knowing what's going on when you leave me and you go home. I want to be in your business. I need to be in your business because that is the only way I can make sure that you are living a full life and that you are going to be able to bring in on this earth a full life. And so, some of the things that I focus on, particularly like right now, I'm actually doing a diaper drive because I was reading something one day and somebody texted me. It's almost as if divine timing. I was reading something about diaper poverty. I didn't know there was a word for it, but I know it existed because there's diaper banks everywhere.
Yeah.
And someone texted me and it was like, "Hey, do you know where I can get or when somebody can get diapers from?" And they're in New Jersey. I don't live in New Jersey. So I'm Googling and all of these places require you to have like an appointment or you have to like attend an event. And I'm like, well, if they probably can't get to the doctor, then they probably don't have time to come to an event. And my mind just started spiraling. I'm like, all right, let me try to put something together so I can figure out how I can get diapers. And often that is how my brain works. Unfortunately, I don't know how to sit down. I see a problem, I have to solve a problem. Um, and then in one of my previous roles, we started a community refrigerator. We opened up a community refrigerator, opened up a food pantry because when I started working in the office where I was at the time, there was only one place to get food. And when you walked in, smell of food stick to your clothes. So
Wow.
if you know, you know. Um, no restaurants, no fresh food. If you wanted any fresh food produce, you had to drive to the nearest market. And even there, when I walked in, I'm like, the lights are dim in here. So
Wow.
I had the idea to open up the community refrigerator. And so that's pretty much how I've been going about things throughout my career so far. I see a problem, I fill a gap. And that's what reproductive justice looks like. You can't address reproductive justice or say that you're a reproductive justice warrior if you're not crossing off everything from all parts of poverty. Do people have access to adequate nutrition? Do they have access to proper care? Are the schools in tip-top shape? Are Where's the parent involvement? What is the violence in the neighborhood like? Do we believe in restorative justice? Like that is what reproductive justice is to me. And all the things that I don't currently know, I will know because I'm about poking my nose in to make sure that we are making sure that moms are able to live long lives and take care of their babies and that they are able to live those full lives as well.
Absolutely. Again, you dropped like 100 gems in there. Um, but I will say two things before we switch over. Um, the recognizing that there are multiple needs along the journey. And like you said, recognizing the need and filling the gap with the appropriate resources. That's what people are looking for and what people need. And I think the other thing that I want to underscore before we move on is everybody's pregnancy journey, like we said earlier, is not the same. There are people who don't have a substantial need as far as social support. They don't have a substantial need as transportation and access to care. And there's others whose needs exceed what any one person can do. And I think for us who are interested in health equity work, those are the people we're focusing on. If we focus on those who need the most, we will, by definition, bring everybody up in the process. And so that's what you were describing, and I'm just doubling down because I feel the same way. So using that as a segue about interconnectedness. So you talked a lot about if we're going to really solve a health equity issue, we have to touch on all the things, right? It's not a single solution to a very complex problem. And so when you started writing, you wrote some about interconnectedness and you wrote some about your motherhood journey. So tell us just a little snippet about each of your books, and then we can do a deeper dive from there.
So I wrote Lessons from Flowers, which is my first book when I was in college. And I actually read it again last summer because I didn't open it for a while because I was like, this, I don't know her anymore. It's not the same.
Mhm.
I wrote I well, let me back up. I've always been fascinated with all things flowers. So when I wrote the book and when I was in high school, different campaigns that I did, so I was very, not high school, excuse me, college, I was very active in different committees and I did pageants and things like that. Everything related to flowers because I love the idea of things growing and us sowing into them, watching them grow from seed to bloom, you know. And so I related my coming to womanhood to that of a flower, to the life of a flower. And I talked about my struggles. I actually had an abortion when I was in high school. And when I got to college, I wrote about how I felt that it needed to be vital for us to have access to mental health care after an abortion because I felt that it really did a number on me and I could only imagine what it had done to other people. So I did research. I did research on it and I found nothing as expected.
Mhm.
Lots of people talk about it. There are lots of campaigns out there for people who advocate for the same thing that I was talking about in my research, but there's nothing there. So my book was a way for me to talk about my experience and my grief, if you will, of having had that abortion. And then I talked about my relationship to my grandmother and how she was really my everything. My grandmother is like when I think of type of woman that I wanted to be, who I wanted to grow up to be, she is that. And so it was so interesting that when I thought of Planted in Good Soil, my starting point was to interview the women in my family. And so to feed off of the energy that she gave me when I wrote Lessons from Flowers. So Planting in Good Soil is me imagining that the women in my family are that soil that I was planting into and to grow. And I'm growing my daughter because I have a 5-year-old. And I talk about a few of the women in my family and how their coming to motherhood story or my coming to motherhood story kind of mirrors theirs and how in some ways they're good, in some ways they are just their realities that are reflecting things that they've gone on in their childhood. So there's a part that I talk about all the time in some of the work that I do now, and that is how sometimes the trauma of the women or the ways in which the women in our family pour themselves out, like, and sometimes almost empty, is not something that we should we should look at and say like, oh, I want to be like that. We don't need to teach our daughters to pour themselves empty. And that was really important for me becoming a mother because I thought I had to like lay myself all out for my daughter, um, and never really take care of myself because now there's another person, and that's just simply not true. We're always evolving. My favorite thing to say is never stop evolving. And in order to do that, I have to never stop pouring into who Michelle is. And she is because I am. And if I stop um, stop placing goals that I'm trying to reach, and I stop, how can I put this? If I stop daring to be bigger, then
Mhm.
what does she have to look forward to in her womanhood? And so I talked a lot about that. And my daughter's actually on the spectrum. I love to share this about my daughter. I feel like every time I talk about her, I'm like, oh yeah, I have a little daughter. She's 5. She's on the spectrum. And I say it like that. I'm always excited to talk about it because I have grown so much as a mother because of that. I realized that something was a little different about my daughter when right before she turned 1. And I went from, I have this little baby and she's adorable, to I have this duty to make sure that I am knowledgeable about all of the changes that she's going to go through in her life. I know what resources I need to find so that I can be a better advocate for her. So much changed in that time. And I'm like, I need to talk my stuff. I need to put this out there so other moms know, I've met so many people along this journey who are like, woe is me, like my kid has a disability.
Mhm.
And I wanted to reinvent what that looked like. I wanted to empower
Mhm.
other moms who are walking that same journey as me. Um, Put it in good soil. It took me, I deleted the book so many times and rewrote it
Oh,
because I was just like, I don't want to write this from a place of rage and like what the world
mhm.
looks like. Because when I was pregnant, I actually read We Live for the We by Danny McClain. I love that book. I give it to every new mom. Like when my friends become mothers, I gift it to them because she talks about how she imagined the world would look when she became a mother and how she put so much pressure on herself for
Mhm.
for the world to already be there when she brought new life there, and how she had to create that life. And that was starting from the neighborhood she lived in to the people that she surrounded herself with. And that's why I go so hard about like creating your village, like identify who your village is and make sure that you all are on the same page, make sure everyone is knowledgeable of like what you want, but not only what you want, make sure everybody is willing to dig deeper into who they are so that we're not copy and pasting trauma
Mhm.
all over the place. Um, I feel like I'm like so off from what you originally asked me, but I need people to read this book because it's amazing. We Live for the Wheat is amazing, and it is part of the reason why Planted in Good Soil is amazing as well, because I was there. I was like, why would I decide to have a kid and the world is falling apart?
Mhm.
Um, but I have in many ways, I feel like I've created a new world for us. Because
Mhm.
I'm advocating for mothers who look like me, to have a chance at not only life, but like I said before, raising full lives because we're doing the inner work on ourselves. And um there's no pity, there's no place for pity and shame here, and especially with young mothers, which I wanted to address something we talked about. You mentioned that when you were in high school, the moms, they come and go, they get pregnant, they're out of the school. I'm actually working with high schoolers now, and I see the effects of that. A lot of their
Mhm.
moms were teen moms, and I see the effects of what that looks like. A lot of them haven't had that opportunity um, to socialize. We know that school is one of the main components of their socialization, and they miss so much from not being there.
Yeah.
um a lot of like life skills they are just not aware of, and it's scary. It's scary. Gen Z is scary, but that's where I come in, sticking my nose and stuff. Where can we fill this gap? What do you need help with? Right now, life skills is something that's like sticking out, and I didn't imagine this when 14-year-old me was like, oh yeah, I want to work with teenage, pregnant, and parenting folk. So here we are.
Here we are, like you said, evolving. I think that is. a perfect word for the imperfect world that we live in, right? Like we have to keep evolving. We have to keep looking inside. We have to keep re-examine the world on the outside because it is evolving too and trying to figure out what our place is and how to affect the change in the part of the world that we can. And so I think you have demonstrated that over and over and over again. I also like that you said, let's not copy and paste trauma. We ain't got to do this over and over again. Let learn from us, right? Like we don't have to do this again. And I think reinserting or re-injecting that sense of community that you talked about a village, finding your tribe, right? We can learn from each other. We can lean on each other. We can support each other and work towards, again, trying to make things better for everybody, and all those who come
Right.
behind us. Um, I have taken up quite a bit of your time this afternoon, and you have dropped, like I said, we're going to have to go back and write all the pearls. We're going to have to drop the book in the description so people can also read that. I'm going to read it. I too like to lifelong learner, like to read and continue to expand my horizon. But as we close, tell me what you are most optimistic about over the next few months.
Hmm. Ooh, okay. Well, we're in an election year, so I'm not gonna lie, I don't know where I am right now with that. Um, what I am most optimistic about. Is this like an overall or
You could be like, I'm gonna go to dinner with my bestie tomorrow, or it could be, I'm gonna, I don't know, be looking forward to a new position, new job. You talked about
Hmm.
the diaper drive. It doesn't matter. It can be whatever.
Okay, I did set a goal for
Most
myself. I
people.
guess I haven't talked about this goal that I set. I there's a mom that I connected with that shared that she's in a shelter, and over the next couple months, I want to help her secure housing.
I like that.
Yeah.
It's tangible, and that will change somebody's life.
Yes.
I love it. Well, thank you for continuing to shine bright. You know how much I enjoy talking to you and have enjoyed working with you and being in your space. I think you are phenomenal and doing phenomenal work. And I am hopeful that you will continue to allow me to go down this journey with you. And I am optimistic that we will be able to work together again soon and do something great. So
Yes. Thank
with
you.
that, thank you so much. And I hope you have a good rest of your day.
You too. Thank you.
Thank you for listening to Reed Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.